Please subscribe to my channel and do hit the bell icon. Hello to all dear students. In this video we will be discussing about measurement of creatinine clearance. So this creatinine, it is an endogenous substance which is formed from creatine phosphate. During muscle metabolism, the adenosine diphosphate, it will take up the phosphate group from creatine phosphate and itself get converted into adenosine triphosphate. Whereas this creatine, after losing phosphate group, will get converted into creatinine, and which is normally it is filtered via the glomerular filtration and thereby get excreted out from our body. Next, we know that there are three steps involved in urine formation, which is the glomerular filtration, second one is tubular reabsorption, and lastly the tubular segregation. When we are talking about creatinine have got 100% glomerular filtration. It has no negligible tubular reabsorption, or you can say 100% no tubular reabsorption. However, a small amount of creatinine may be actively secreted by the renal tubules. Now you can say that creatinine production is equal to creatinine excretion under a normal condition. In cases of renal disease like uremia, the glomerular filtration rate reduces. Okay, so when GFR is reduced, there will be reduction in renal function. Next, there will be reduction in renal clearance. Because of reduced renal clearance, the drug will get accumulated inside our body, leading to drug toxicities. Next, how to know whether kidneys are working properly or not, or normally or not? A simple answer to this question is by determining the creatinine clearance. As we know that creatinine production is equals to creatinine excretion. When the GFR is reduced, then creatinine excretion is also reduced. So you just need to calculate the creatinine excretion. If the creatinine excretion is less than normal, it implies that the GFR is also reduced. And when GFR is reduced, means the kidneys are not working properly. So the creatinine clearance may be defined as the volume of plasma cleared of creatinine per unit time. So creatinine clearance can be calculated directly by dividing rate of urinary excretion of creatinine with serum concentration of creatinine. Here the urine is collected for 24 hours and the rate of urine collection, it is given the unit ml per minute, and the serum concentration is given in unit mg per deciliter. So this rate of urinary excretion of creatinine is measured for the entire day, that is for 24 hours, to obtain a reliable excretion. Whereas this serum creatinine concentration, it is determined at midpoint of urinary collection period. Means this urine is collected for 24 hours and its midpoint will be the 12th hour when serum creatinine has been determined. Next, this equation is used to calculate creatinine clearance in ml per minute when the serum creatinine concentration is known. Okay, so in this equation, this thing is the creatinine clearance. This is creatinine concentration in urine in mg per ml. This one is volume of urine in ml collected per 24 hours. Okay, for one entire day, for 24 hours the urine collected, that volume of urine is V. But as you can see over here, we want the unit in ml per minute. So we don't want the how much amount of urine is collected in 24 hours. We want it in minute. So we need to convert 24 hours in minute. Okay, so 24 into 60 will get 104.40 per minute. Okay, so we need to calculate how much volume of urine is collected in 1440 minutes, and same thing is present over here in this equation. Next, this thing is the creatinine concentration in mg per deciliter in serum taken at 12th hour. Now mg per deciliter means mg per 100 ml, and same thing is present in this equation. Next, creatinine is eliminated primarily by glomerular filtration. A small fraction of creatinine also is eliminated by active secretion and some non-renal elimination. Therefore, creatinine clearance values obtained from creatinine measurement overestimate the actual GFR. Lastly, creatinine clearance value must be considered carefully in special populations such as elderly, obese and emaciated patients, since their muscle mass is too low. So these are some important points that you should take in mind regarding the creatinine clearance. Next, this equation we have to calculate creatinine clearance, but more accurate methods are based on patient's age, height, weight and gender. So keeping that in mind, we have got Jellif's equation that is like this: creatinine clearance is equals to 98 minus 0.8 into age minus 20 divided by the serum creatinine. So here not only serum creatinine but one more important thing, that is age is been considered, and not only age, even gender. So if the patient is a woman, so we need to multiply this equation with 0.9. So in Jellif equation, two important factors are being used, or two important variables are being taken, or two extra variables you can say. Okay, as such we have got three variables, that is age, gender and the serum creatinine. Okay, serum creatinine is obviously very much important, so the two extra variable utilized over here is age and the gender, but not weight. So when weight is a problem for obese patients, generally defined as patients more than 20% over ideal body weight, creatinine clearance should be based on the ideal body weight. Estimation of creatinine clearance based on total body weight would exaggerate the creatinine clearance values in obese patient. Okay, so we do not take total body weight in case of obese patient. We need to check the ideal body weight. So we have got a formula for calculating it. So the lean body weight in males is equals to 50 kg plus 2.3 kg for each inch over 5 feet. Similarly, for females we have 45.5 kg plus 2.3 kg for each inch over 5 feet. So when obesity is not a problem, we can use the Jellif's equation, where we can find three important variables, that is serum creatinine, age and gender. But when weight is a problem, when that particular patient is an obese patient, then we should also take consideration weight. So for that, in that condition, we cannot use Jellif's equation. So for that we have got Cockcroft's and Gault equation, which is somewhat like this: creatinine clearance is equals to 140 minus age in year into body weight in kg divided by 72 multiplied by the serum creatinine. So this is Cockcroft and Gault equation, where you can see consideration has been given for age, serum creatinine and weight, plus gender too. If the patient is a female patient, then we should multiply this equation with 0.85. So you can see in Cockcroft and Gault equation, four variables are being used, that is age, body weight, serum creatinine and gender. Next, for children, there are number of methods for calculation of creatinine clearance in children based on body weight and serum creatinine concentration. So for now we have Scott's equation, which is like this: creatinine clearance is equals to 0.55 into body length in centimeter divided by the serum creatinine. Here 0.55, it represents a factor for children who are aged 1 to 12 years. Next, Another way for calculating creatinine clearance is by using nomograms. So we have different nomograms for adults and different nomograms available for children. So have a good look on these nomograms. If you want, you can even take screenshot for these nomograms. Okay. Next, we'll have some practice problems. So first problem goes like this. What is the creatinine clearance for a 25-year-old male patient with serum creatinine of 1 mg per deciliter and a body weight of 80 kgs? So first of all, using a nomogram. First of all, we need to see what all is present in this nomogram. So over here, a center R is there. This is the line for serum creatinine. This is for age. This is for males. This one is for females. Weight and clearance, that is creatinine clearance given in ml per minute. So these all scales are being available on these nomograms. So how we need to use this nomogram is, first of all, we need to connect age with weight with a help of a ruler. Okay. So for age, you can see we have got two options, whether it is a male or female. So check out in the question, it is 25-year-old male. So it is a male. So we need to check on the male and the age is 25. Next, what is the weight? Weight is 80 kg. So with the help of a ruler, you should start from 25 years male and 80 kg with female with a ruler and let the line intersect the R. Okay. So this R. And this R is very much important because we need to connect the intersection point at the line R with the creatinine concentration point, that is mg per deciliter, and extend the line to the intersect the creatinine clearance. Okay, so from serum creatinine we need to start and we need to intersect it at point R and we need to see where it falls on the creatinine clearance. Okay, so like this. The extended line will intersect the clearance line at nearly 130 ml per minute. Okay, 130 ml per minute, giving the creatinine clearance for the particular patient. So we found the answer for our question, that is creatinine clearance. We found it at 130 ml per minute. So we'll just cross check with the help of the Cockcroft and Gault equation. We'll insert all the variables whatever is present, age and body weight and serum creatinine, and we found the value nearly 127.77 ml per minute, which is almost similar to what we found the answer from the nomograms. Similarly, we have got another problem. What is the creatinine clearance for a 25-year-old male patient with the serum creatinine of 1 mg per deciliter? The patient is 5 feet 4 inch in height and weighs 103 kgs. So 103 kg is not a normal weight, it is an abnormal weight. So you can say the patient is obese and the creatinine clearance should be based on the ideal body weight. So we need to check the ideal body weight. We have got this formula. And what is the gender of the patient? Yes, he is a male. So we need to consider this formula. So the lean body weight in males is equal to 50 kg plus 2.3 kg for each inch over 5 feet. So what is the height? 5 feet and 4 inch. So we need to write it like this. 2.3 multiplied by 4. So we'll have the value 59.2 kg. So this is the ideal body weight of the patient. Now using the Cockcroft and Gault equation, since the patient is obese, so we'll have this equation and we should put all the values of age, weight and serum creatinine and we'll have a value like this, 94.6 ml per minute. So this is the creatinine clearance of the person. Next, one more practice problem we'll have. Determine the creatinine clearance for 80 years old male patient weighing 70 kg and having serum creatinine of 2 mg per deciliter. Use both Jellif's and Cockcroft and Gault equation. Okay, so we need to use both the equation and we need to calculate the creatinine clearance. So first we'll start with Jellif's equation, and the equation goes like this. Creatinine clearance is equals to 98 minus 0.8 into age minus 20 divided by serum creatinine. And we should keep all the values. All means we have just two values, that is age and serum creatinine. And we'll have answer this much, 25 ml per minute. We found the value of creatinine clearance as 25 ml per minute by Jellif's equation. Next we'll try it with Cockcroft and Gault equation, where not only age and serum creatinine but even body weight is taken into consideration. So we should keep all the values, and we found the value of 29.16 ml per minute, which is almost similar but not that similar. Okay, but the advantage of Cockcroft and Gault equation is here we are considering body weight, which gives it more weightage as compared to Jellif's equation. So whenever you are given any problem where weight is considered, so better you go with Cockcroft and Gault equation. But if in the problem suppose only age and serum creatinine level is given, so you can go with Jellif's equation. But when body weight is been present, then you should go with Cockcroft and Gault equation. If the person is obese, now obviously you need to go with Cockcroft and Gault equation. But anyways, if the data for weight is present, so better you go with Cockcroft and Gault equation instead of Jellif's equation. Next we have another problem. Calculate creatinine clearance for a 30-year-old female patient with a serum creatinine of 0.8 mg per deciliter. The patient is 5 feet 1 inch tall and weighs 69 kgs. Now what all things are given? Yes, we have age, we have got serum creatinine, we have got weight also, plus the gender. The patient is female. So in the Cockcroft and Gault equation, you should multiply it with the factor for female, that is 0.85, and keep in all the values. The patient is not obese, so we need not to calculate the ideal body weight, and we'll have answer like this, 111.945 ml per minute. So we have got the answer. Creatinine clearance was found to be so and so ml per minute. Very simple. And another practice problem will have, calculate creatinine clearance for a 23-year-old male patient with a serum creatinine value of 1.2 mg per deciliter. The patient is 5 feet 5 inch tall and weighs 98 kgs. Okay, so 98 kgs means the person is obese. So we need to calculate the lean body weight. So first of all, the Cockcroft and Gault equation. What is the gender? Gender is male. So no need of multiplying with the factor. We just need to calculate the lean body weight of the male. 23 multiplied by 5, because it is 5 inch, and we got the value 61.5 kg. Now very simple, put all the values and we'll have the value of 83.28 ml per minute. Okay, so creatinine clearance was found to be 83.28 ml per minute. And another practice problem will have, using the method of Cockcroft and Gault equation, calculate creatinine clearance for a 36-year-old female patient with a serum creatinine value of 1.8 mg per deciliter. The patient is 5 feet 5 inch tall and weighs 58 kgs. Okay, so 58 kg means the patient is not obese. No need of calculating the ideal body weight, but the gender is female, so we need to add the factor for female, that is into 0.85. and sometimes this height 5 feet 5 inch, sometimes it is given to confuse you people, so that you should think that whether the person is obese or not. Okay, so do not get confused, and you should properly keep all the values and just calculate, and we'll have this much value, 40.43 ml per minute, and you need to write the report of the same. So this is how we'll calculate these equations. Okay, so this was all about the measurement of creatinine clearance, which is done for determination of glomerular filtration rate. I hope you people find this video helpful, and thank you for watching.